our member institutions, and we are presenting there so that we can have the opportunity to share as a secretariat a new product that we have shared, that we have developed, of course, in collaboration with one of our member institutions, and are hoping that we can carry this forward as has been our tradition of delivering courses that make a difference in terms of provision of healthcare in the region. Our presentation today is going to look at remind us all who Africa Capacity Alliance is. We are then going to jump straight into the business skills training course, giving you a background of what it is and the rationale behind ACA Secretariat, thinking that the course, the business skills training course, is important. Then we'll also look at the approach that we propose or that I've used, as we shall see, to deliver this course. We will give you an overview of the course itself in terms of the course outline. We will also give you a brief overview of the pilot phase, which ACA finalized in July this year. And we will then, from our point of view, give you the value that this course can be to you as our member institutions. And finally, we can think together about the next steps. We then have the question and answer session. The Africa Capacity Alliance, just to remind us all, is a network organization, and I've reiterated this again, that we are the secretariat here in Nairobi, but you are the ACA because you're the member institution. So the 37 member institutions make the ACA, and the organization or all the member institutions are specialized in training and building the capacities of institutions across Africa. And ACA, just as the secretariat and the members, are specialized in individual institutional capacity building initiatives aimed at improving health outcomes in the region. As we all know, we have delivered, both as a secretariat and in collaboration with the members, have delivered over 500 courses to over 7,000 health workers. And these courses are all designed to empower healthcare workers with a wide variety of skills that are required to improve service delivery. Now, we all know that as ACA, we've been delivering the courses. ACA and its member institutions have delivered courses that have, in the past 16 or so years, been targeting specifically provision and improvement of HIV and AIDS healthcare provision. We know as ACA Secretariat and also as our member institutions that situations have changed and that we have to respond to the changing situations in terms of health in Africa. Therefore, this business skills training course is fulfilling this mandate of our flexibility and adaptability to address issues that will improve health outcomes. So consequently, it does not specifically focus on HIV, AIDS, improvement of skills per se, although it can be part of it, but broadly look at what can make a difference in health sector despite the kind of service that a health facility is offering. Therefore, as a background of this, we know that in Africa, the private health sector, which in this case will include for-profit and non-governmental organizations, serve a large majority of people. A few statistics that in Kenya, we have nearly half the population of Kenya being or seeking health services from private healthcare providers. In Uganda, we have about 60%, and in different respective countries, we have various studies that show a large portion of the citizens in those countries seek their healthcare from private healthcare providers. Therefore, it implies that the private healthcare sector cannot be ignored, and attention needs to be paid so that the services that they provide to this large proportion of population is quality and is also a beneficial to the enterprise that offer these services. Now, we know that the majority of these private sector providers in health operate either small or medium-sized enterprises, which are being referred to as the SMEs. And these SMEs are owned and operated by healthcare practitioners who, in most cases, have no formal training in business or financial concepts due to their background. They have gone through medical school, and during their training, they did not have the time or the opportunity to be able to get this kind of training. Therefore, these providers then lack these skills to manage their enterprises, which they so are running today and which are providing these essential services. As a result, many businesses become unsustainable and eventually shut down within the first year of operation. And this applies to healthcare, but also we have seen studies, especially also in Kenya, where it shows that out of every 3 SME that open, at least one shut down by the end of the year. This too applies to healthcare businesses. Now, when the healthcare businesses close, it negates the whole purpose of why they opened, and furthermore, because they opened so that they can provide services. First of all, one invests a lot of time, a lot of money, a lot of energy in always, to start this business. So once it's closed, there are losses that are related to all these aspects: financial, time, emotional, energy that go to the practitioner. On the other hand, it reduces the positive health outcomes of the target population, because this so-called SME was opened to serve this population. So it's a lose-lose. The entrepreneur loses, and it does not at the same time serve the population for which it was meant to serve. Recognizing this, ACA therefore acknowledges that business skills training has great potential to benefit healthcare. Their businesses will be up, more people will be able to receive healthcare services from them. Therefore, ACA, together with its member institutions, and of course borrowing from what is being done globally, especially through USAID support and Banyan Global, has adopted a course on the business skills training for the entrepreneurs, which seeks to unleash entrepreneurial spirit of the private health providers through the BSc course. And this course is specifically designed to target managers and or owners of healthcare enterprises. We as ACA envision that once we offer this course to this particular group of people, that private healthcare practitioners and their enterprises will be equipped with skills which are essential to run successful businesses, which are profit-making, and consequently, they'll be able to provide quality healthcare services to their clients. Having recognized this, ACA adopted the course developed by the SHOP project and adopted it to the local situation, especially here in Kenya, so that we are able to offer a course that can be taken up and that can be applied. So our unique approach to this training is that we as ACA aim to bring this professional development closer to the practitioner. Just a quick explanation is that we do not want to centralize this training of providers, because the private providers are spread all over the country, in Kenya and elsewhere. Even when you talk about places like Malawi, Zambia, who a large proportion access their services from non-governmental organizations, we know they're spread all over. And it may be a hindrance if one, for example, in Malawi says that we have to provide this course only in Blantyre or the capital city, and we may lose out. So we hope that this course then is taken out to those far-flung areas so that it is flexible enough and closer to the people. We also will offer this course in a flexible manner with flexible schedules for completion. And this means that we will have, like we explained in the next slide, we will have a schedule where practitioners who are enrolled for this course are able to do this course at their own time, but of course within a fixed time frame. Therefore, one will be able to probably take the course after office hours or during their off days, without necessarily having to be limited to a particular time. This is what we mean by flexibility. This course will also be delivered through a blended learning platform, which minimizes time away from work. So we can see all these points is that we, as much as possible, want to have this course delivered in such a way that it does not hinder or interfere with the work that the practitioners do. This course is going to be delivered on an ongoing basis, training for the private healthcare in a flexible manner. And it is going to be delivered in 2 phases, where we'll have the first phase being a 3-day classroom face-to-face training, which will then by the second phase, which we shall see below. During this 3-day classroom training, we will have an opportunity to incorporate networking opportunities among the course participants, because this is when the learners or the participants will be together. We'll also be monitoring the uptake of course concepts and facilitate practical learning. So we will apply, in other words, adult learning methodologies during this phase, but in a classroom setting. Like I've said before, 3 days, we know, yes, is much, but to cover the concepts of this this kind of training, it could take longer. But we try to rather put this context in the face-to-face learning in 3 days, so that the concepts are we have time enough to deliver the concepts, and the rest can be completed under phase 2, which is basically involve on-the-job supervision, including mentoring and coaching. And this we propose as ACA can take 2 forms. The mentoring and coaching could involve the facilitator of the course having visits to the practitioner facility and or an online platform. Now for ACA, because of various factors that we considered and the Kenyan situation, we chose for the pilot phase, which I will discuss shortly, to use an online platform. This is a platform where a learner interacts with the facilitator via online, and one is able to submit their assignments to the facilitator, and the facilitator is also able to give feedback. This gives a lot of flexibility, but we appreciate that this requires proper internet connection. The course during the whole approach or during the whole delivery will deliver core foundation of business skills, which are integral to the growth and sustainability of private healthcare enterprise. I would like to just give you a sneak overview of the course outline. Once we adopted the curriculum from the USAID supported SHOPS project, we adopted it to our situation and came up with 10 core modules that incorporate various aspects. And as you can see, the modules involve starting your health practice as a business. They're given, questions as I remember, like when we did the pilot, we were asking health practitioners or the participants whether they think the health practice was a business. And that topic and discussion around that gives a lot of insight to the facilitator on how to tailor the course, on what to deliver. So that's one of the modules that really puts the participants into the mood of running your health facility as a business enterprise. The other modules will involve human resource management, customer management, marketing your health practice, including understanding how the market around you works, pricing your products and the services. We also have a module on managing medication, medical supplies and medical equipment, which include how to procure, how much to procure, when to procure, how you can monitor them so that you do not have too much procured or too little procured. So all this is covered in this course. The module also, we also have a module on understanding quality and regulatory compliance in health practice so that you are legally, compliant. We have a module on risk management and in health practice, record management, finance management for private healthcare providers, such that you don't run your business like your kitchen, where you take in and out at your will. And we also have a final module that really touches on managing the growth of your practice. Once you have learned how to, do your practice as a business, it's inevitably going to grow. Then how do you manage the growth? Do you still remain a one-man show like many of the health practices are? How do you bring in other people you might view as strangers? So these are just but a few of the issues that are discussed during the course, and which help you to look at how you can manage your health practice. The outlet, like I've been mentioning, we as ACA, together with one of our member institutions, piloted this course because we wanted to deliver this course in practical and real terms, in classroom terms, not just like a guinea pig, but to also the aim of this pilot phase was to help us further, deliver this course in real life situation, and also get feedback to enhance the delivery of this course in the future. So together with Amref Health, which is one of our member institutions, Africa Capacity Alliance, created a framework that can be adopted to suit the needs and requirements of diverse healthcare providers and also diverse environments. The pilot phase was implemented between the month of May and July 2014. We had a class of 20 students that was enrolled, and we had a completion rate of 75%. That's 15 of the 20 enrolled students completed the course. The post-course evaluation was done, and we had quite some positive feedback. I'll just give a few points where we realized that from those that responded to this end of course evaluation, the 7 out of 9 indicated that the course objectives were fully met their training needs. Another feedback was that 8 of the 9 respondents, that's nearly all the respondents, indicated that the topics covered by the course were relevant to their work, and that 6 of the 9 respondents said that knowledge and skills that they acquired from taking this course was applicable. So basically, there's much more in terms of what the respondents said, both qualitative and quantitative, but generally we had positive feedback that this course actually is required by private healthcare practitioners and would be useful in sustaining their enterprises and therefore improving provision of health services. A quick quote from one of the participants there, and a picture as well. That is a picture from the previous slide. That was a picture of part of the class for the pilot, and this is a picture of the graduation, or rather participants receiving their certificates after completing the course. You can see that one of the participants, who actually owns one of the big hospitals in the eastern Kenya, Meru, said that the course enlightened them on things that they have gone through and has enabled them to see where they have failed, and therefore be able to have some adjustments and appreciate the course. And for your information, this is a hospital that has been running for the past 30 or 35 years. So you can see this course really comes in handy for even established enterprises. Now, that's basically what I've presented is issues on the course and issues on the pilot. And the aim today was to not only give you information, but also together evaluate the value that this course can be to MIs themselves, and also help ACA, which includes here the member institutions, with continuing the mandate that they have been implementing for the past 16 years, building the capacity with relevant courses for private health, with relevant courses to be able to offer to the market. Therefore, our offering as a secretariat is that we have already invested time and resources in terms of time, money, and the rest to develop a curriculum. We have a ready curriculum in place, and this can be rolled out with minor adjustments, of course, if need be, to our various clients or various situations. From the feedback given by the participants, you also see that this is a course that can go out to the market. It's in demand, it's out there, and this can actually be also illustrated by the fact that we started marketing this course, and by the time the class was ready to kick off, we had an overwhelming number of participants. We just needed a class of 20 people, but we got over 30 applicants, and unfortunately for them, we could only be able to take 20 for the pilot course. So this demonstrates that this course is actually in demand, and it's something that we need to take out to the market or out there to benefit the health sector. Again, from the feedback, we see that this is a relevant and outcome-oriented course in the sense that it's really providing skills that can improve both the outcome of an enterprise in terms of business and the outcomes of health for the population. And last, but the most important point, especially internally for ACA member institutions, is that we know that most of the quite a sizable number of member institutions are in the business of providing health care or health services in their respective capacities. Now, it's also not a secret that these institutions actually have been benefiting or have been focusing mainly on provision of HIV/AIDS services, which have mainly also been supported through donor funds. Given the changing landscape in terms of donor funds and HIV funding, and also more importantly in terms of health focus for our continent, we might find as member institutions the need to ourselves be sustainable through looking at the services that we provide now from HIV and the rest as an enterprise or as businesses that can help us, keep in business, so to say. Therefore, I see this course, first of all, as relevant to internal members to take it and to have the skills instilled so that they can be sustainable in themselves, and then secondly, roll it out to other institutions that are offering these services. So this is the value as ACA Secretariat that we see for this course being already in place. The next steps, and this is also the ones that I've mentioned here in terms of the value to ACA MIs, you could think of others that how would this course be of benefit to you as a member institution. So the next step is that as ACA Secretariat, we want to have this course rolled out to both our MIs and also with our MIs, so that we also can have the benefits of this course internally and externally, and also use our expertise that we've been using for the past period to do the HIV and AIDS improvement of skills. And with that, here is our contact details. You also have our contact details in other ways. You can contact us. We can discuss further. And thank you very much for listening. So this is the end of my presentation. Should you please have a question, type it on the window that comes up, and it shall be facilitated and I can answer back. Thank you very much.
Thank you, Lucy, for the wonderful presentation. Remember, as we mentioned earlier, if you missed any part of this presentation, it will be available to you on the ACA sites, and a link will also be sent to all meeting attendees at the end of the meeting. So following that nice presentation, we welcome any questions you may have. You can type it on the chat plane, then we'll be able to read them out to the presenter and she can be able to answer any questions that come up. Thank you.